Today on Substance Stories, we're going to be demystifying psychodynamic psychotherapy. I hope you enjoy. Welcome to Substance Stories, and today we are going to be talking about psychodynamic psychotherapy, part of our process, our mission to sort of discuss and demystify all the psychotherapies there are. I've got with me today Dr. Josh West, a psychodynamic psychotherapist and expert extraordinaire. Friend and colleague. Josh, thank you so much for joining us on Substance Stories today.
Thank you so much for having me. It's great to be here.
Josh, what is psychodynamic psychotherapy?
So psychodynamic psychotherapy is a type of psychological treatment, and it stands in distinction to things like cognitive behavioral therapy or the other type of psychotherapies that are out there. And I suppose a good way of thinking about it is, psychoanalytic or psychodynamic. For the most part, they're pretty synonymous. Both terms refer to a sort of family of therapies that can have different views of human functioning and variations in their language, but there are some pretty core common features here. And I found this great review article from 2000 that showed like what are the necessary and essential features for any type of psychodynamic treatment. And what it involves is there are 7 core features. So there is a focus on the expression of a patient's emotion as a big one. There's an exploration into an individual's attempts to avoid certain topics or engage in things that maybe hinder the progress of therapy. Really, it's a lot about pattern identification on behalf of the therapist. So it involves identifying what are the certain repeating patterns in the way someone acts, the way they think, they feel, their experiences and their relationships with others. There's a big emphasis on past experiences, a focus on their interpersonal relationships and experiences in relationships with others. There's a big emphasis on the therapeutic relationship, the here and now between the patient and the therapist. And it involves an exploration of their wishes, their dreams, and their fantasies. So those are, in this review, what they determine as the 7 sort of core distinguishing features of a type of psychodynamic psychotherapy. What I might say is if I were to reduce it down to one real thing that separates it from others is that psychodynamic psychotherapy presupposes the existence of the unconscious and that there are unconscious mechanisms at play that maybe lead to maladaptive ways of thinking and feeling and relating to others.
Amazing. And what I love most, Josh, is that before this chat, you were like, I'm going to keep all the complicated psycho jargon out of what I'm saying. This is Josh at his least intellectual. I just want everyone to know that this is him dumbing himself down. Imagine how inadequate I feel in this man's peer group. So I guess what I heard there was that it's about emotions and it's about exploration. And we've done a previous podcast with another therapist, Josh, and we talked sort of about bottom up, the top down psychotherapy. And I mean, this is the king of the bottom up, isn't it? It's about exploring ourselves. If I'm doing psychotherapy with you, you're not going to tell me what to do ever. Or I should imagine, or perhaps ever is a strong word, but it's going to be less instructive than when perhaps I'm doing psychotherapy and I'm focusing on how to sort of regulate my emotions. You want to get to the core of why I'm having those emotions and let me to get to the core, I should say, and let me explore that rather than tell me, to have a cold shower or something along those lines. Would that be a fair statement?
Yeah, I think that's pretty fair. It takes a different sort of approach. I mean, if you think about the CBT sort of triangle, we know that the way that we think about things can affect how we feel and then affect what we do. And likewise, the type of things that we do or don't do can affect our thinking styles about ourselves and others and the emotions that we have. And a sort of a top-down approach might look at, how can we address some trips and traps in the way we think, so that it's more helpful, or how can we change what we do on a day-to-day basis from sort of a behavioral activation to change how we feel about ourselves and what we think. The psychodynamic is way more bottom up, and it sort of thinks of the question, but why do we think these things about ourselves? Why do we do these things? Why do we find ourselves in the same problems over and over again? And trying to get to the root of all these things and unearth what's maybe outside of our awareness so that we now have knowledge of these things. And with that knowledge comes opportunity to do things differently.
Amazing, Josh. Who would you recommend psychodynamic psychotherapy to? Everyone?
I mean, while I quite like psychodynamic therapy and I've sort of fallen into it, I think of it as kind of the foundation of all different types of therapy. Like I'm trained in other things and I do what's necessary. So, I think there's a time and a place for CBT and DBT, some of the more behavioral things. And there's been examples where I have been working with someone psychodynamically and it just hasn't really been helpful or we haven't really gotten anywhere. And then I sort of identified that there were some real things that they would benefit from DBT. And then we've taken a bit of a pivot and they've made great improvements. But generally, I think that psychodynamic sort of work, in terms of what it actually looks like, is you typically would go to a therapist once a week or maybe twice a week. Um, and you come in and you sit down in a chair or you lie down on the couch and you're encouraged just to start talking. Um, you know, because what comes out of that is content that is all, as Nancy McWilliams says, is all grist for the mill. Everything can be used. Everything can be made interpretations of, because the therapist's role is to identify patterns in what you're saying and what you're thinking and notice, like, this is reminds me of what you said about this person last time. So I generally find that psychodynamic therapy is really good for long-term psychological change, sort of characterological problems that people have that they haven't had much luck with other types of treatment. This is where psychodynamic work really is beneficial because it's a process of let's slow things down. Let's not look at symptoms or sort of presenting complaints. That would be considered the tip of the iceberg in psychodynamic work. That underneath all of that is a whole host of motivations and relationship templates and things that are feeding this cherry on top symptom as perpetuating. And how do you address that from a top down approach if that's failed? Well, you need to slow things down. You need to look at it from a bottom up, and that just takes time. That takes time. You have to work with a very skilled therapist that can listen and be attentive to identify these patterns, because by their definition, they're not going to be immediately available to someone to talk about freely. They're going to be largely outside of awareness and unconscious.
And incredible. We have talked to an extent about that before previously in terms of a good psychotherapist doesn't feel beholden to one form and uses it swaps between sort of modes appropriately. So exactly as you were sort of saying there, one of the, and what you were saying with sort of this the time it takes for psychotherapy.
Yeah.
One of the things that people often come to me when and say is, when I say, look, unfortunately don't have a condition that's going to respond well to medication, but psychotherapy is does have a good evidence base in treating this condition. They then can get impatient and say, well, I want to be fixed now. Like, what are we going to do? How do you respond to that? Because I think that's one of the big frustrations people can feel with sort of more long form psychotherapy is, yes, but my life is shit now, and I'd like a path to get better now.
Yeah, and that can sometimes be part of it. That can be maybe some of the things that you work on with this person. Do they have this sense of urgency, or that they've sort of tried everything and now they have some frustration with their treating clinicians? Do they feel like, well, this isn't fair. I should be fixed by now. Um, what am I paying this money for? And actually, almost like, um, having this sort of transformed aggression towards someone else of, well, hang on, I'm coming to you and you haven't fixed me. In psychodynamic work, it would involve thinking, well, hang on, what do we mean by fixed, and and what have you tried so far? And then also, where do you see your role in this in terms of your recovery and getting better? Is there a hidden Oh, possibly. Possibly, yeah. Is there maybe this hidden fantasy of being rescued and saved by someone that if I just do what I'm told and sort of passively accept this treatment, um, that one day I'll be fixed, and if I get some hiccups, then it's evidence that what I'm having given to me so far isn't working, and does it position this person in a role of this sort of passive sufferer, that sort of declines subsequent treatment to saying, "Well, that didn't work. Give me your next best thing." So I think that's sort of how I would approach that sort of presentation. Looking at what has worked, what hasn't, and then what are their expectations for treatment, and how do they see their role in their own recovery?
What about the other criticism I hear about psychodynamic psychotherapy, that, it's in its ivory tower. It's just for people that are overly educated and have too much money on their hands to go to a psychiatrist's clinic room and toss each other off.
That's a good point, I think a good and a valid criticism, actually. If we look at it, I think Jonathan Shedler has written on this quite a bit, that psychoanalysis and psychodynamic work, it has an image and a marketing problem, actually. And historically, they did sort of rule the landscape of treatment before we had more effective biological treatments and psychological treatments. And it did become really siloed and a bit ivory tower. And if you read some text, you're like, what are you even talking about? They use these terms that are like absolutely divorced from any sort of reality. And they become this intellectual exercise. And I guess maybe that was my impression coming into it, that we're all talking about, these things like repression and unconscious mechanisms, and they've given these jargon terms that from translation from German compound words from Freud. And you're sort of wondering, how does this actually apply in day-to-day life? And I sort of wondered myself, like, is that all it is? If you go in, is it just sort of these two people armchair intellectualizing about, oh, of course, well, you feel this way because of a relationship with your mother, and oh, you're doing repression there, I can see. And that was a misconception that I had once I started doing this sort of work and also getting this therapy myself. Bring it back to, the core features of psychodynamic work is the focus on emotion, actually. It's deeply emotion focused, in the here and now, using everyday words and language that the person can understand. Um, I think there's a real disconnect between the actual literature on psychoanalytic theory and psychodynamic work and actually practicing it. It's very human. It's very non-jargon language, is how I might describe it.
I couldn't agree more. Emotions and the relationship is what it's all about. Now, I want to take a moment for you to
Yeah.
explain some of the words you've been using, repression, suppression. Can you explain what defense mechanisms are?
Okay, will do. I can do this. Okay. Again, jargon. We have these terms as if they're a thing. They're not, okay? They're a shorthand. So very quickly, defense mechanisms. All that means is anything that we do to avoid thinking about something. It is ways of these sort of loopholes that we do. The idea is basically at the core of psychodynamic thinking and unconscious is that it's not only that there are things that we don't know that are outside of our awareness, but there are things that we don't want to know, actually. because they're fearful or they cause anxiety or they seem to be inconsistent with how we view ourselves or our own values. So a defense is any sort of process that we do in our thinking or in our behavior that keeps those fearful things at bay, ways that we prefer not to think about or think about ourselves. An example is you mentioned repression, and I'll give you a very brief anecdote of what I saw repression happening in front of me. And it was perfect. It was just chef's kiss. I wish I could have taped it and shown it to people to teach what this is happening. And this is a very benign example. We were in a work and we were all having some lunch together and we were going through some gratitude cards and looking at, think of a good memory that you had or something. And there was a clinician there and he drew a card that said, think of a film that you wish you could watch again for the first time. And he looked at it, he read it out loud. He said, oh, well, there's one film that I would think about. I quite like it. I wish I could see it again. Maybe not with the person that I saw it with, though. And I'm like, okay. And he said, it's, what is it? It's that, it was on the tip of my tongue. It's that, that film from the 90s. It has that one, that guy that was in everything at the time. He was like a child actor. Oh, it's like kind of sad. What was it? And I sort of piece it together and I think I said, is it My Girl? He's like, yes, My Girl. Oh, yeah, My Girl. So what was happening there in that little brief moment? This person was prompted to think of a film that he wished he could see again for the first time. And that film came to mind. And then he immediately said, oh, but I wish I didn't see it with that person I saw it with at the time. And then when he had to say the name of the film, he couldn't. Something was happening in his mind that maybe that memory of that person was painful for some reason. And suddenly, whatever was associated with that, his mind said, no, I don't want to think about that. So it's not only that he didn't want to think about that person in that moment, but that the associations around that person and what he saw, he actually was lost for words. It was on the tip of his tongue and he couldn't bring that to his conscious awareness. So that's an example of repression. And we all do this all the time.
That's a perfect example. I've got another example for you. Say that there was a psychiatrist who went through training with another psychiatrist who was clearly more emotionally and intellectually intelligent than him. Then maybe he would go out and start a podcast where he would try and prove his intelligence in some sort of reaction formation. All the while, his subconscious knows that he's not as intelligent as you, Josh. I mean, sorry, the other psychiatrist.
Well, we all use defenses all the time, and it comes down to, some of them are adaptive and others are less adaptive. Does it cause you trouble or does it actually, bring you up to a level where you're functioning at a higher level than before?
So you've talked about how psychodynamic psychotherapy, we understand these repeating behaviors that we have. And I think this is especially important for addiction. So Can you explain how we identify and manage and understand and change these sort of repetitive, unhealthy behaviors we have through psychodynamic psychotherapy?
I would say that probably the real benefit of psychodynamic therapy and how it helps us with these sort of patterns is that inevitably they play out in the therapy. Okay. And it's a unique sort of relationship that you have because people have these relationship templates or they do these things in certain ways and it's completely mystifies them. They don't know why they are the way they are. And they can tell you all these stories about how it's happened in the past and how it's likely to, happen again in the future. And not only is the therapist sitting back and noticing these patterns and trying to help this person understand how it's playing out again, but inevitably it will play out again in the relationship with the therapist because that's a relationship as well. So if someone, they long for intimacy, but they sort of fear abandonment and they result in these relationship breakdowns over and over again, these conflicts that they have while they are unconscious, they leak out through different symptoms and behaviors. So what's going to happen is, of course, that's going to play out in the therapy. They're going to get close to the therapist and feel trusting of them, and then they'll pull back, or they'll forget a session, or they'll not pay, or they'll stop answering their phone and they won't turn up for a few weeks. And the risk is, if that's not addressed or spoken about, that just sort of perpetuates in their life. But the unique thing about psychodynamic therapy, where there's a focus on the here and now relationship, is that you can talk about it. You can say, hey, I noticed this is happening. What's going on? And this person might have all these excuses and resistance. Oh, my car broke down, or my grandma died. And it's like, okay, well, you can't have more than 4 grandparents, and it seems like 12 of them have died in the last month. Or we all have car problems, but it sounds like yours is a particularly broken down car. It's about sort of gently cutting through those resistances and those defenses and being like, well, yes, I hear it, and that's all makes a lot of sense, but I just wonder if something else is going on. Is there a part of you that feels maybe we're getting too close to something, or you feel a bit threatened by me? And if, they're open and vulnerable, like, well, yeah, maybe that's the case, then you can actually talk about it. And then suddenly, not only do they have insight into this behavior, but they can see examples of how it's played out, and then it gives them an opportunity to do something different. I think that's really what it's all about, psychodynamic therapy, is that we all have characteristic ways of thinking and feeling and repeating things in relationships. And for many people, that's fine. They can live full, rich lives. But for others, it can kind of constrain them. It can cause them to live a very restricted life where they're not able to achieve their goals, that they get in their own way. And this just gives them an opportunity to have a bigger repertoire of ways of responding.
Thank you so much for joining us today. I've really enjoyed it. I hope the listeners have really enjoyed it, Josh. It's been an absolute masterclass. Hopefully one day we'll get you back to talk about your other passion, which is psilocybin-assisted therapy. I hope everyone's enjoyed.